Hi friends, I'm Adira Rajendran, one of the faculties from Bliss Institute, Sharjah. Today I'm here with some OET sessions, so we will be discussing a letter. Before moving to the content part, just we are introducing ourselves to you. And we are here for the last 16 years of successful running business, and especially we are focusing on care to nurses and other paramedical staffs. And we will helping you for assisting in international exams like DHA, MOH, HAT and other language examinations like OET, IELTS, PT and all. And here we are doing the processing of examinations as well as until the exam we are supporting. After your exams, and we will fulfilling your dreams, and placement options are also we are providing. And this is our successful career for the last 16 years. And here I'm with an OET video and a letter we are going to discuss. And students are facing some difficulties whenever a letter is coming with some non-professionals. And it's not a non-professional, I'm telling you that something which is beyond with dietitian, physiotherapist, occupational therapist, music therapist and social worker. And if such kind of professionals are coming to our letter writing, people are finding some difficulties. And some nurses or other medical professionals are finding some difficulty whenever they are choosing their professionals. Actually, it is a language test. Always it will assess your language, not from your profession or something. So whenever you are going to write a letter, it will be so simple and the reader should understand everything. And here I'm with a dietitian letter. Simply we have to read the writing task first. Exactly we have to find the reason for writing, the purpose of our writing. Here there is a patient, her name is Nina Sharma, and she has some problems with the swallowing and nutrition. So here a task is there to write a dietitian that they must understand her functioning of swallowing as well as nutritional status. And in this question paper there are some informations regarding her history, one of the experience in the last day with obstruction with food. So in that last experience, that day she had some episode of choking on a piece of food, and she got some treatment or some modalities, and there she escaped from there itself. And because of this episode and some other reasons are there to help, so the patient is referring for a dietitian to assess her swallowing, and she is a dementia patient as well as she has some swallowing issues. Dentures are there and she is forgetting to use that in some disorientation and confusion associated with the dementia. So some information it is given in this letter, just I can note it down. Her name, full name is important, date of birth it is important. Then some medical histories it is given. Ischemic heart disease, stroke, severe dementia, diabetes mellitus, osteoarthritis. So these all are the some disease condition. Exactly we have to mention this because it is a dietitian. But the treatment or what are the measures we are following, it is not relevant because some information, important information only we have to write in this letter. And other something which is weight gain, something related to her weight, BMI. For a dietitian, BMI is important, and some histories of chronic constipation it is there. So we can mention that also. Then some appetite factor, it is also there. So this is also an important information. Then other than that, in this task or in this detailed description, some vital signs, some complaints, etc. are there, but these all are the things that are irrelevant. So we can frame this letter, as usual, we know that we have to write a date. So today's date we can place there. After that, you can write the address of dietitian. Then you can make a title, Dear Dietitian. So sometimes people are confusing with the name of dietitian. If it is there, you can use the surname. Otherwise, you can place the designation. It's a dietitian. So Dear Dietitian you can write. Then after this, you can write your patient's name, full name and date of birth. It's better. Then start with an introduction. So in the introduction, you have to write the reason for referral as well as what happened to the patient and why you are referring that. Simply you can mention 2 times. That is increased risk of aspiration. This is a problem, and the purpose, that means an urgent assessment of his following function and nutrition status. So I'm recommending you to write 2 things in your introduction. First one, it is the reason, high risk of aspiration. And second thing is that urgent assessment. It's because of assessing her swallowing function and nutritional status. Then coming to the content part. So the first paragraph, body paragraph 1, you can mention something related to her dementia and other swallowing issues. So I said a history of choking, it is this that you can mention in the first paragraph, and simply you can mention a choking episode with the improperly chewed food, and second sentence you can write she escaped from that by grabbing. Then next thing is an important thing which can be mentioned regarding her dentures. So she uses that dentures but forgetting to wear, with the confusion and disorientation associated with the dementia. Then one more thing, it is semi-relevant thing. She has a history of throat clearing after eating yogurt. It is not too relevant, but it's a semi-relevant factor, so you can explain that in the first paragraph, body paragraph 1. And second body paragraph, you can mention all the diseases she had. So especially her IHT, stroke, osteoarthritis. And after that, you can mention in another sentence with the type 2 diabetes mellitus and following a diabetic diet. It's also important. And coming to the diet, you can connect another informations like her meal pattern. She is having more meals with increased appetite. Then weight status. She has adult weight, more weight is there, overweight it is there. You can mention the BMI as well as her weight there. Then finally, one more problem she had, that is a chronic constipation. So that is also you can mention there associated with the diet. So in a flow, we can write this like a story. We can mention all the description in this letter and we can conclude it with a request of assessment sooner. So this is a content part. So you can write, and for further information, you can contact us. Definitely we will be assisting you for all OET sections, and I think this video will be helping you, and you can watch more videos, and we will be coming with other videos of other sessions. And thank you for watching us, and you can contact Bliss Institute Sharjah and Bliss Academy Kottayam. So we will be assisting you. Thank you.